but he just proceeds to drag Gobert, a large human, by his neck. Something that in and of itself adds to the danger of what is being done here in this sequence.
嗨，欢迎来到 RG 篮球。前几天在勇士对灰狼的冲突后，绿师傅遭到了5场禁赛的严重处罚。这集将由知名运动学家 Brian Sutterer 来解释绿师傅对 Gobert 的动作到底有多危险，一不小心就可能对 Gobert 造成不可挽回的伤害。
One of the most concerning things, honestly, about this whole sequence was how Draymond initially went in just with his forearm on the front, striking the front part of Gobert's throat. When we look at our biodigital anatomy tool here, that can result in a lot of trauma to the larynx or to the trachea, even the hyoid bone. The hyoid bone is this small little floating bone that sits within the trachea that you can feel, and then the tracheal cartilage right here is that sort of Adam's apple that you can feel in the front of your throat. But as you can tell, there's no protection there. And so if you've ever been hit in the front of your throat, this can be extremely painful. In the sports world, we can actually see athletes get trauma. You can get fractures to this laryngeal cartilage that can be a really significant injury and put you out for a long time. So that first moment where Draymond just comes in and his forearm hits square in the front in that Adam's apple, in that larynx, in and of itself, can result in some direct trauma, fracture to these laryngeal structures. The next part of this then that's really terrifying and just awful to watch is how Draymond just basically tries to drag Gobert by his neck. We'll talk about these different chokehold positions, but he just proceeds to drag Gobert, a large human, by his neck. Something that in and of itself adds to the danger of what is being done here in this sequence. Remember that in the world of mixed martial arts, when people are applying grappling techniques, they're applying chokes, they're usually a gradual progression to get into that position. It's not this quick, sudden, aggressive movement of dragging somebody across the ring. But when you get into this position, this is a little bit more typical for a choke, a blood choke. Draymond's arms are trying to compress along the sides of Gobert's neck. Now, if we look at our anatomy tool here, we have to talk about the blood flow. The first muscle we see right here is the sternocleidomastoid. The SCM muscle runs from down here on the collarbone up to this mastoid process in the back of the ear. If we hide that sternocleidomastoid muscle, then the first thing we're going to see is the external jugular vein. Of course, veins delivering blood back from the body down to the heart, whereas the artery, the carotid artery, is going to deliver blood from the heart up to the brain. This whole structure that sits right here that's being affected with a blood choke is the carotid triangle. And in there, you're going to have the internal carotid artery, you're going to have the common carotid artery, and then you're also going to have some nerves. Whenever somebody applies a choke, there's pressure put externally onto these arteries, and you do a couple of things. Number one, if you hold pressure long enough and hard enough, you're going to compromise the blood flow to the brain. Whenever the brain has impaired blood flow, eventually the response, you lose consciousness and you pass out. Part of the reason why your body's trained and designed to do that is that theoretically, if you pass out, you go flat, and then when you're flat, you allow blood to better distribute throughout your body and get back to the brain. The second thing that you can affect if we hide our vein here is in this area, we have a couple of structures. The carotid body is a chemoreceptor. So basically it senses chemical changes, and it sits right here at the bifurcation, and its job is to sense alterations in the oxygen level, the chemical levels of things. Carotid sinus is then more of a pressure receptor. It interprets that as the blood pressure is high in the body, and it signals down the stream effects to allow the blood pressure to relax. Now, if you apply external compression to that carotid sinus, you're going to falsely make the brain think that the blood pressure is really high, which is going to cause it to decrease the heart rate, which can then also impair the blood flow up to the brain. Now, the air choke is different. Of course, now we're trying to target the structures with the air, the windpipe, and you're not necessarily going to compress the trachea. With a wind choke, it's more the uncomfortableness, just how much more painful and intolerable it is to have direct pressure applied to the